So welcome. This webinar is brought to you by the New Hampshire Training Institute on Addictive Disorders. You can access the recording of this webinar on our website at nahatica.org. After completing this webinar, please upload and complete the quiz if you're interested in receiving a certificate. You can find the quiz in the file pod throughout this presentation on our website, nahatica.org, or you can email us at thetraininginstitute@nahatica.org. You can email, mail, or fax the completed quiz. Contact information is on the quiz itself. If you're a member of NAHATICA and NADAC, the certificate for this webinar is free. If you aren't a member, the fee is $15. You will receive a certificate worth 1 CE once you have completed and passed the quiz and paid for the webinar if applicable, within 21 days. Throughout the New Hampshire Training Institute on Addictive Disorders, this 1-hour event is pre-approved by the New Hampshire Board of Licensing for alcohol and other drug use professionals, as well as the MVCC. If you have any trouble viewing this webinar, audio problems, or have any technical questions, please contact us at 603-225-7060. Please email any questions regarding the material you see today to the Training Institute at nahatica.org. And you can find and upload these introduction slides in the file pod to the right of your screen. And with that, I'm going to turn you over to Mike Lawless to talk about the Certified Recovery Support Worker performance domains.
Thank you. Well, good morning. It's my pleasure to be here this morning to talk about this topic, and it's an exciting topic to get into. So the title of this training is Certified Recovery Support Worker, or CRSW, Performance Domains. And so that's the overarching statement around what we're hoping to kind of get into a little bit. But at the same time, I think that there's some really important pieces to this that are not necessarily covered in that title, and so that's the nuts and bolts of the training. When we think about this credential, CRSW credential, this is a credential that's governed by the LADAC board for the state of New Hampshire. But what we're really also talking about is what is the day-to-day interactions, job duties, aspects of a person's job responsibilities that could be covered under a broader title of peer support or peer recovery. And so that's exciting for me to get into. I'm very much looking forward to this. And so some questions that I'd ask you to consider is, what brought you here? What do you hope to get from this training? You know, in a live interactive classroom setting, this question really can open up a pretty thought-provoking and sharing type of experience around why people are in the room, and we start to get into concepts like purpose and meaning and giving back and being supportive and growing in our own experiences as peer supporters, but also the real reward of seeing others grow in their recovery journey. So I'd ask you to think about that. What do you hope to get from this training? What brought you here? And what are you willing to contribute? Again, you know, in a classroom setting, we have the structure of we're going to be interacting for these, you know, in that setting it may be 6 hours, or even if it's an hour. What are you willing to contribute? You know, acknowledging that there's a give and take to a training. But I left that question here because even though this is me imparting information, I think this is an interesting question for you to consider as well. So what are you willing to contribute to the work you do? What are you willing to contribute to the field? You know, that's a rhetorical question in part because of the setting, but also in part because you already may be doing this work, you know. And so I'd ask you to think about that more in terms of what do you bring to the field? What do you bring to this work? What is the spirit of how you work with others that you bring into the room? You know, I have a quote here that I like to mention because it really speaks to something to me, which is so it's new service roles sprout from the soil of unmet need. New service roles sprout from the soil of unmet need, and that's by a W. White from 2006. That quote is around peer support and peer recovery. I'm going to mention the ICNRC Credentialing Center throughout this training, but there's a list of materials available there, and one of these articles were referenced there. That's where I was able to get my hands on that quote. And it's a really powerful statement. And in terms of peer recovery, I think about that. What new service roles sprout from the soil of unmet needs. So what was the unmet need? In some ways, I think it's important to acknowledge that peer support has been around for a long time. You could make the argument that that is the oldest role in the helping field is the peer support role. What I think is going on now, especially when we think about this credential of CRSW, one, it's becoming more acknowledged around the vital role that peers can play. But it's also getting the acknowledgement and the professionalism that goes with the job title and job description, and then the credential of a CRSW. When I think about the different roles that peers have played, they may have fallen under different job titles, different job descriptions. But again, I think in the helping field, it's always been an acknowledged role in the work. Now, when we start to think about the differences in what goes along with the job performance, you have to kind of delineate the differences between a peer support worker, a clinical person or clinician, AA or 12-step sponsor, and other types of helpers, right? Because there's different responsibilities and requirements that go with those different roles and titles. So SAMHSA has identified 10 guiding principles of recovery. And as we get through this training a little bit, we're going to kind of incorporate these concepts in different ways along the way. So the first one in the 10 that I'll name is hope, the importance of hope. Do the people we work with have hope around their recovery or their progress in their journey? And how do we instill hope and support an environment where hope can develop and flourish? The next principle is that it's person-driven. So instead of it being prescriptive in terms of the professional saying this is what you must do to obtain recovery, being person-driven is to recognize the individual and be supportive of the individual having a voice and choice in their recovery decisions. Many pathways. This concept is really around respecting the individuality of recovery and how people can obtain recovery in different ways, and recovery may mean different things to different people. And where do we come to terms with our view of recovery as opposed to maybe the individual who we're supporting, their view of recovery? And are we flexible enough to challenge our beliefs and aware enough to say maybe this is a bias of mine or something that I need to talk to a supervisor with because I'm struggling to support this person in this area of their recovery? Another principle is that it's holistic. So being holistic means that it takes into consideration the whole person, the mind, the body, the spirit of the person, the emotion of the person. That it's not necessarily just around one facet of the individual, like their choices around substance use. It also considers the various other aspects around who they are as an individual, their journey, their self-care. Another guiding principle is peer support, which we're here to talk about a little bit today. And really recognizing the role of the peer in terms of supporting an individual in their recovery journey, but also helping them connect with resources and grow in different ways. And just, there's many different areas that a peer can be helpful in the recovery journey. Another principle of recovery is that it's relational, that there's a relationship involved, and that there's maybe many relationships in somebody's self-care system, but that it acknowledges that, again, that there's this give and take, there's this presence, and it's not a one-sided providing information, but there's a give and take, there's a back and forth, there's a mutual respect and an opportunity for these kind of qualities to occur. Another principle of recovery is that it considers culture. How do we consider culture in terms of how we support others and are available to them? Culture is an important thing to consider because it can shape our view of the world and our value system. And so are we sensitive to the fact that people have different cultural backgrounds, and we cannot assume that we know something about a person's culture, even if we think that they may have the same cultural background as us. There's variations in cultural beliefs, and this is important stuff to consider when we're helping others. Another principle of recovery is that it addresses trauma. We're going to talk about this a little bit more throughout the morning, and it's a very important piece around being supportive of others. One thing that I will share about this concept now is that, in the medical field, there's this idea of universal precautions. And so best practices around trauma now is that we approach it as though we're utilizing universal precautions. Not only with the individuals who we are working with as a peer supporter, but also with our colleagues. So the idea behind that is that there's a good chance that the people that we're working with and for may have some trauma history. And we have to be sensitive to that. Even though I may not share that with you directly, your interactions with me ought to be guided by a trauma-informed approach, or sensitive to the fact that perhaps I do have some trauma experience. Another principle of recovery is that it takes into consideration the individual's strengths and also responsibility. And finally, the last one that we'll name here is the principle of respect. And I think in many ways, what we've been talking about so far really touches on that. Respect for the individual, respect for the individual's autonomy in their life, their choices, their dignity and worth as a person. So these guiding principles will really guide us in our journey here this morning. So I have here a couple of definitions of recovery for your consideration. The first one says recovery is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. And it seems these are concepts that we've been touching on, the idea of a self-directed life and a process of change, an opportunity to improve health and wellness. And then the second definition is recovery is what people experience themselves as they become empowered to manage their mental illness and or substance use disorder in a manner that allows them to achieve a meaningful life and a positive sense of belonging in their community. So now we're talking about recovery in multiple ways. We're talking about recovery as an internal experience, in a process, a kind of an emergence into a new life. but also a sense of achievement, a sense of meaning, and a sense of belonging in a community, which are really powerful concepts to consider, where we know how folks who may be struggling with addiction may not feel like they're a part of the community, or the role that they play in the community is not one of inclusion. So now what we're talking about, this is a holistic view towards recovery, that we're considering all aspects of the person and really about how they may become more a part of their community. And so here's a definition of peer recovery support. And this was taken from the Rhode Island Peer Support Study Guide. I have a reference at the end of this training for the Rhode Island Peer Support Study Guide, and also the ICNRC website, which I mentioned earlier, where I actually was able to come across this peer support study guide. Also, for individuals who may be thinking about taking the exam for the CRSW credential, I'd highly recommend accessing this Rhode Island Peer Support Study Guide to help you prepare to study for the test. So peer recovery support is defined as an individual who has lived experience with mental illness and or addiction to alcohol and other drugs, and it has also completed formal training, who provides one-on-one strengths-based support to peers in recovery. Now, when we have these kind of discussions in a group format, one of the first things that comes up is this idea of a lived experience. And what I would mention here is a couple of things around that concept. So one, I think you'd be hard pressed to find individuals who don't have some form of lived experience with alcohol or other substances. I think whether we're talking about the individual's personal lived experience, or a friend, or a family member, a lot of folks' lives have been touched by addiction and mental illness. On another note, it is not a requirement in New Hampshire to have that personal lived experience to become a CRSW. So in other words, in New Hampshire, in order to pursue and obtain the CRSW credential or to work as a peer supporter, it's not a requirement that you be in some stage of recovery from alcohol and other substances. You know, when we dig into this definition a little bit more, we start to talk about things like formal training and one-to-one strengths-based support. And so in the 10 guiding principles of recovery from SAMHSA that we just discussed, we're touching on this idea of one-to-one strengths-based, you know, identifying the person's strengths, supporting those strengths, and being a role model or a supporter to help them kind of grow in their recovery. But the formal training of this piece is one of the real differences, and there are others, but it's one of the differences of being a peer in, say, a 12-step program, or a sponsor in a 12-step program, or other type of self-help where you may receive peer-to-peer support in your recovery. The difference of this role of a peer recovery person is we're starting to talk about the formal training of it. We're starting to talk about requirements, and we're going to get into what some of those requirements are. So when we think about peer support, there's 4 performance domains that have been identified as areas to be aware of and develop in order to provide peers the most support possible. Those 4 areas are advocacy, ethical responsibility, mentoring and education, recovery, and wellness support. And we're going to get into those a little bit more as we go along. So when I think about the role of peer support specialists, I think of these specific areas guiding our process or the work that we do. You have the revised statutes annotated, or RSAs. And these are the laws that govern the credential. You have the administrative rules in the late act board, and these are this process is looking at the RSAs and teasing it out more so and putting numbers and aspects to the requirements so that folks can actually pursue the credential and know what is required. You have things like codes of ethics that govern the work of peers, and then institutional policies. Peers can work in a variety of settings, and so it really is in their best interest to understand the program policies where they work so that they can be within their scope of practice, doing the work that they're able to do under the RSAs, but also aware of what's required of them in the particular program where they work. And as important as these areas are above, the RSAs, the administrative rules, codes of ethics, and institutional policies, another thing that really guides the work is the individual experience, biases, beliefs, feelings, thoughts, and potentially spirituality of the helping person. So we're going to look at these a little bit closer. So under occupations and professions, alcohol and other drug use professionals are given guidance around what is covered by the credential that they seek. What's within their scope of practice. And so here it says the purpose of this chapter is to protect and benefit the public by setting standards of qualifications, education, training, and experience for those who seek to obtain a certificate of a certified recovery support worker or a license as a licensed alcohol and drug counselor or a master licensed alcohol and drug counselor, and to promote competency in alcohol and other drug use prevention, intervention, and treatment services, and in co-occurring disorder treatment services. So this outline is really saying this is the board, this is the statement that we'll make around what credentials are covered here and the overarching goals of each particular credential or license. So as we get into this a little bit further, we see that there's some aspects of this that are geared directly toward recovery support workers, certified recovery support workers, scope of practice. What am I able to do by law? What's the boundary of the work that I'm able to perform when I'm a CRSW? And it says the provision of basic screening of persons with substance use and co-occurring mental health disorders to determine whether referral for further assessment and formal diagnosis is needed, in the making of appropriate referrals. So as a CRSW, I'm able to do some screening and look at the results of the screening instrument. If the screening suggests that a further assessment or perhaps a diagnosis may be appropriate, then as a CRSW, I'm able to make a referral to somebody who's able to do a more thorough assessment and perhaps come up with a diagnosis. So we'll look at screening a little bit closer. And so screening is defined as a brief process that occurs soon after the individual seeks services and indicates whether the individual is likely to have a substance use disorder and or mental health disorder. Typically, screening instruments are self-administered. And so you would hand that to the client and they would be able to complete it with some basic instructions. And there may even be a scoring process that as a peer support worker you would be able to score once you have been trained in how to score it and what directions to give when you pass that screening instrument on to the peer. And so here I have a list of some of the more common screening instruments that folks may come into contact with in their work. So the first screening instrument that I'd like to bring up here is the CAGE screening tool. I'm going to get into this one in a little bit more detail, but it basically looks to see if an individual has cut down on their drinking at any point, been annoyed by somebody criticizing their drinking, if they felt guilty about their drinking at any point, or had an eye opener. But again, we'll explore that a little bit further. Then you have the Riazi. Cut. So the first screening instrument that we'll look at is the CAGE, C-A-G-E, and I'm actually going to get into that one in a little bit more detail further on, so we'll put that one on hold for now. Then there's the Riazi, developed by the Research Institute on Addictions Self-Inventory. That screening instrument in particular is often used in DWI programming. It has a recidivism scale in it. Then we have the DRI-2 or driver risk inventory. Again, this is another screening instrument that is used in DWI programs. It measures 5 particular areas: truthfulness, a person's relationship with alcohol, a person's relationship with drugs, their stress coping, and their driver risk. Then there's the audit or alcohol use disorder identification test, the opioid risk tool, the MAST or Michigan alcohol screening test, the DAST or drug abuse screening test, the SASI-4 or substance abuse subtle screening inventory, and the ASI or addiction severity index. Now there's many other screening instruments that a person may come into contact with depending on the type of program where you work. One thing that I would suggest is SAMHSA, as I mentioned earlier, is a great place for resources in many different areas around substance use and mental health. And they also have TIPS and TAPS, which is a larger resource guide in specific areas, and there's resources around different screening instruments that could be used depending on what we're screening for and this particular setting. So here's a closer look at the audit or alcohol use disorder identification test. And it may not come up really well here, but I'll read one of the questions. So number 1 says, how often do you have a drink containing alcohol? Never, monthly or less, 2 to 4 times a month, 2 to 3 times a week, 4 or more times a week. So this is a very straightforward process in terms of a screening instrument. The question is asked, the client gives an answer, the answer will give them a certain score, and then I would be able to tally the score. If their score is above a certain level, then that would suggest that perhaps they need a more in-depth assessment or evaluation, and that's the place, like we were discussing earlier, where I would be, as a peer supporter, I would be referring them for further treatment or assessment. And again, always under the guidance of a supervisor. The next instrument is the DAST, again, drug abuse screening tool. And a question from the DAST is, number 3 says, are you always able to stop using drugs when you want to? No or yes. And so the same idea here as what we had just discussed with the audit. This is a self-administered screening instrument. As the peer, my job responsibilities may require me to give a peer this kind of screening instrument, ask them to fill it out, maybe give them some directions around how to fill it out, and then possibly scoring it. The CAGE questionnaire. So this can be used in a variety of different settings. It's really brief in nature, and it gets basic information about a person's relationship with alcohol. So the questions are, have you ever felt you should cut down on your drinking? The C in cut down is for the C in CAGE. Have people annoyed you by criticizing your drinking? Have you ever felt bad or guilty about your drinking? And have you ever had a drink first thing in the morning to steady your nerves or to get rid of a hangover? That would be for E, for the eye opener. And so this screening instrument can be used in many different settings. And if a person has 2 or more yeses on this brief questionnaire, then there's some evidence that perhaps they need a more thorough assessment. And so that would be a place for referral to a LADAC, maybe within your agency, or some guidance from your supervisor around what that referral process might look like, whether it's internal or external referral. So as we look at this a little bit closer, the provision of monitoring of clients' health and safety, including basic recognition of signs and symptoms of addiction, intoxication, and withdrawal, and the implementation of structured interventions to ensure the immediate safety of clients demonstrating such symptoms. So becoming familiar with signs and symptoms of addiction in different substances. What does impairment look like? What does withdrawal look like? What is the recovery process about? When we think about withdrawal, we're not just talking about the immediacy after a person stops using. There's also post-acute withdrawal, which can last much longer. And so becoming familiar with the signs and symptoms of addiction, intoxication, withdrawal, and recovery is an important part of the role. How do we handle safety situations in the agencies where we work? Again, I would refer you back to supervision. This is a place to discuss. Again, I would refer you back to having this kind of discussion with your supervisor and wanting to know and understand what is the program's policy around situations of safety. What are my duties if I'm concerned? How do I handle that? I would recommend that's a discussion that should be happening in an ongoing way with your supervisor. The provision of recovery support, including practical support, mentoring, and education about addiction, community peer support, the role of medication, and co-occurring disorders and addiction. So these are the areas that are within the peer support worker's scope of practice. And adherence to the ethical standards of the substance use treatment profession as determined by the board, by the LADAC board. So these 4 areas that we've gone through and identified really cover the scope, the legal scope of a person's practice as they are CRSW. The next piece that we look at is the administrative rules, which are developed by the LADAC board. And these can be accessed in the alcohol ALC 303 rules. or 300 rules, but Part 303 is specific to CRSWs or people pursuing the CRSW credential. And some of the highlights that I would name here is that in order to receive that initial certification as a CRSW, the individual has to be at least 18 years of age, reads and writes in English language, has a high school diploma or its equivalent, 500 hours of paid or volunteer work experience in the last 10 years. They've completed at least 46 hours of education in the 4 performance domains, has passed the examination. So there's an examination for the CRSW credential, which I mentioned the Rhode Island Peer Support Study Guide is a good resource for that examination. They also will be required to have 16 hours of education in ethics related to substance use counseling, 6 hours of education in suicide prevention, and 6 hours in HIV and AIDS education. Discussion question. DAST stands for Data About Substance Use Treatment, Defining Alcohol Substance Tendencies, Drug Abuse Screening Tool. C. Drug Abuse Screening Tool. The Code of Ethics also governs the work that we do as peer supporters. I would suggest, and again, this resource is available towards the end of the training, accessing the NADAC Code of Ethics, administrative rules, and utilizing supervision as a place to learn and continue to grow under the Code of Ethics, which really informs the work that we do. And then there's our institutional policies, which really, as a worker, I should be coming into contact with these very early on, if not immediately upon hire. So questions to consider for peers. Where you work, is there a written policy manual? How is familiarity with policies handled? As a peer supporter, do you understand your job description? And how are you to handle conflicts of interest or other difficult situations? What is the work culture around these things? And these are the questions that should inform your participation in supervision. Not only is it the day-to-day interactions with the peers and the work that you're doing there, but getting guidance from your supervisor around these specific things so that you can be within your scope of practice at the job. And this really ought to start at orientation. A thorough orientation is easy to skip over, but it's a very important thing for a new member of the team. And now I'd like to consider individual experience, biases, beliefs, feelings, thoughts, and perhaps spirituality. How does this impact the work you do? What is your awareness around the impact that this may have on your working with others? Again, this is a place where supervision is really important because we all bring this into the field. We have our own history. We may have some beliefs, perhaps some biases, feelings, and thoughts about things, especially around things like recovery or self-care. And so we want to make sure that in order to be in line with those 10 guiding principles of recovery, we're aware of our own internal process and how that may be impacting the work. And one of the best ways to know how we're impacting others is to use supervision in a way where we can speak about what's going on for us and receive feedback about what we may need to be aware of. So we're going to dig into these performance domains a little bit more. So we're going to talk about advocacy. Some of the requirements under advocacy are to relate to the individual as an advocate. When we're peer support workers, we are an advocate. We advocate within the system to promote person-centered recovery wellness support services. So we're focusing on the peer that we're helping. We have an important voice as peer support workers. We want to inform the individual who we're helping about their individual rights and responsibilities. When they enter into your programs where you're working, how will they learn about what their rights and responsibilities are? Well, you have an important role in making them aware of that. Another piece to advocacy is to apply the principles of individual choice and self-determination. So being aware that the individual you're helping should have a very big say in what their recovery looks like. It's our task to explain the importance of self-advocacy as a component of recovery and wellness. Sometimes individuals who are pursuing recovery or early in recovery may not have a lot of experience advocating for themselves. So in some sense, as a peer worker, we are advocating for them, but we're also encouraging them and modeling how to advocate so that they can become advocates for themselves. We recognize and use person-centered language. We practice effective communication skills, and we differentiate between the types and levels of advocacy. So advocacy can occur at different levels. It can occur if I'm a peer support worker. It may occur when I go to a treatment team and I have an opportunity to advocate for the peer by talking about where they're at and what they're working on in our work. It may also happen at higher levels where I advocate to the administration for this individual peer. And then there may be opportunities to be an advocate in the community in a larger sense. Advocacy continued. We collaborate with individuals to identify, link, and coordinate choices with resources. So we become aware of what resources are available, and we continue to grow our resource list so that if somebody is seeking some kind of support, we know where the support might be, or we might at least know who to ask where the support might be. But we always respect the individual's choice. They may not take the resource that we have available. They may not think it's a good fit for them. So understanding where they're at and what they believe they need and respecting that is an important piece to this. Advocating for multiple pathways to recovery and wellness. And recognizing the importance of holistic approach to recovery and wellness. The next performance domain is ethical responsibility. Recognize risk indicators that may affect the individual's welfare and safety. Respond to personal risk indicators to assure welfare and safety. Communicate to support network personal issues that impact ability to perform job duties. Report suspicions of abuse or neglect to appropriate authorities. Evaluate the individual's satisfaction with their progress towards recovery and wellness goals. Maintain documentation and collect data as required. Adhere to responsibilities and limits of their role. And apply fundamentals of cultural competency. What I would suggest here is where there is 16 hours of required ethics training, which we discussed earlier, Some things that stand out to me in these particular areas are the importance, again, of having this discussion with your supervisor. And really what I would suggest is printing out this training, and when you're getting supervision around the 4 performance domains, being able to talk about these individually and say, what is the program's policy? How would you see this particular task under ethical responsibility applying to me and my role here? Ethical responsibility continued. So recognize and adhere to rules of confidentiality. When we talk about confidentiality in substance use and mental health, we're talking about HIPAA and 42 CFR. And so you'll no doubt receive training on that as you pursue the credential. And also in an ongoing way, we are required to learn and stay current on ethical responsibility in the field. Another task under ethical responsibility is recognize and maintain professional and personal boundaries. Again, this also ties into the professionalism of the role of a peer support worker. What are the boundaries? What are the limits to how I interact with this person? Which are much different than interacting with somebody as a self-help peer or as a sponsor, and perhaps even as a clinician. And so you'll require some guidance around where are the personal and professional boundaries. Some of that may be specific to the role you have or the agency where you work, but getting clarification around that is really important. Recognizing personal and institutional biases, maintaining current accurate knowledge of trends and issues related to wellness and recovery, recognize various crisis and emergency situations, and using organizational departmental chain of command to address or resolve issues, and the importance of practicing non-judgmental behavior. The third performance domain is mentoring and education. Serve as a role model for the individual. Recognize the importance of self-care. So not just talking about self-care and being able to identify resources about self-care, but really engaging in our own self-care. Working to establish and maintain a peer relationship rather than a hierarchical relationship. So in some sense, there is the hierarchical relationship because you're maybe an employee of an agency. But how do we work in an ongoing way to try to maintain that peer relationship and relate to the individual as a peer? Peers can educate through shared experiences. They support the development of healthy behavior that's based on choice, describe the skills needed to self-advocate. So as we talked earlier, initially you may be the advocate, and that may vary depending on the setting or the person's development, but there may also come a time where you teach them the skills that are required to advocate for themselves, and the benefits and challenges that can come along with that, and assist the individual in identifying and establishing positive relationships. Such an important aspect of recovery. Being able to know who are the people around me that I can rely on, who are the people who are helpful and encouraging in terms of accomplishing my goals. Mentoring and education continued. Establish a respectful, trusting relationship with the individual. Demonstrate consistency by supporting individuals during ordinary and extraordinary times. That's probably my favorite task in this particular domain. I'll repeat it. Demonstrating consistency by supporting individuals during ordinary and extraordinary times. I think recovery is an extraordinary process, and The role of the peer support worker in being consistent when days feel ordinary and extraordinary. It's quite an honor to be in that role. Support the development of effective communication skills, which we know is such a vital quality to develop in recovery. Support the development of conflict resolution skills. How do I deal with disappointment? How do I deal with challenges or conflicts or disagreements? Support the development of problem-solving skills, apply principles of empowerment, and provide resource linkages to community supports and professional services. And the fourth performance domain is recovery or wellness support or wellness support. Assist the individual with setting goals, recognizing that there are multiple pathways to recovery and wellness. Contribute to the individual's recovery wellness teams. Assist the individual to identify and build on their strengths and resiliencies. Apply effective coaching techniques such as motivational interviewing, recognizing the stages of change, recognizing the stages of recovery and wellness, recognize signs of distress, and develop tools for effective outreach and continued support. Recovery wellness support continued. Assist the individual in identifying support system. Sometimes individuals enter into recovery and they don't have support systems, or the relationships have been strained. Part of our role is to help them develop a support system and then identify who is part of their support system. We practice a strengths-based approach to recovery and wellness. We assist the individual in identifying their basic needs. Perhaps we apply basic supportive group facilitation techniques if we work in an agency that provides group format. And we recognize and understand the impact of trauma. Wellness is defined as not merely the absence of disease, illness, and stress, but the presence of purpose in life, active involvement in satisfying work and play, joyful relationships, a healthy body, and living environment and happiness. This is what we're striving towards, not only for the peers we support, but also for ourselves as peer support workers. And this process is, helped to be facilitated by concepts of like self-care. And self-care is very individualized. What's part of my self-care plan may not be your self-care plan. So for some, it may involve things like self-help meetings, perhaps 12-step programs, exercise, medication management for some, counseling. Maybe some engage in meditation and journaling. A helpful activity would be to build resources around what are some components of self-care, what is available. What have peers who you may be working with done in the past that they found enjoyable? What were hobbies that they have done in the past, but as their use increased, they pulled away from things they once enjoyed? Discussion question. When pursuing initial certification as a CRSW in New Hampshire, an applicant must have at least how many hours of ethics training? D, 16. Now this is an example of a self-care plan, and the reason why I included it here, I think that there's many different types of wellness plans or self-care plans that you can put in play. But I would encourage you as a helper to look at something like this, develop your own, and perhaps also use it with the peers you're working with. It looks at areas around mind, body, emotions, spirit, and asks questions like current practice and new practice. work, relationships, and there's an area to personalize it by putting in other. What's an important part of your self-care plan, your maintenance plan, however you want to frame it. And the third sheet here says barriers to maintaining my self-care strategies, how I will address these barriers and remind myself to practice self-care, negative coping strategies I would like to use less or not at all, what I will do instead. And when we think about building a recovery plan, there are some components to a recovery plan that are quite necessary. They need to be goal-oriented and person-centered. What are we working towards? How do you want to get there? They ought to include short-term and long-term goals, daily and weekly action plans. So there's something about having plans in a daily or weekly way that introduces consistency, but also teaches us that larger goals are incremental. So we can see our struggles or successes in an ongoing way as we work towards that larger goal. A recovery plan also ought to have a personalized list of tools, lists of triggers or warning signs, again, individual. What's a trigger for one or a warning sign for one may not be a trigger or warning for someone else, or it may not be as strong of a trigger or warning for someone else. The more that this is individualized, the more it gives us the opportunity to see where a person may be struggling or succeeding, but it also gives them an opportunity to learn more about where they may be vulnerable and where their strengths are. The names of the individuals in their support system should be included. Stress management skills like deep breathing and relaxation response. A plan of how people can help you in crisis. What happens if there's a return to use or a relapse, return to serious symptoms? Now I put this slide in here. We won't access it in this setting, but this was developed by the University of Utah to give people a more interactive. It looks at, I believe it's 7 different chemicals and how they interact with the brain. Alcohol, marijuana, cocaine, among others are described here. Supporting each other and changing. So this is a slide about the stages of change. And we know that for some, relapse and recycle can be a part of the change process. Perhaps the preparation stage, maybe I start to hope that the behavior can be changed. It's also called the planning stage. I'm looking for the options to help. Then there's the active stage, action stage, where I'm actively working towards change. I'm engaging in activities that support change. I plan to continue the new adaptive behavior if I'm in the action stage. And then the maintenance stage. I like to call this stage living the change. If I'm in the maintenance stage, I have the new behavior for a minimum of 6 months. The new behaviors are habitual and have replaced the old behavior. And then we think about relapse and recycle. In some places you hear the term slip. It could be a return to the previous behavior pattern, and a person may be discouraged. One of the things that's nice about the stages of change model, from my perspective, is that it helps us understand that change is not an event, it's a process. And so I may be in the active stage, action stage of change with, say, opiates, but maybe pre-contemplation with alcohol. So a person can be in different places with different substances or different problem behaviors. And notice that this slide, the trauma-informed approach, the 6 concepts to consider with the trauma-informed approach are not showing, so I will read them. But before we get into that, I'd just like to talk a little bit about the stages of change model that we just discussed and principles of motivational interviewing, which were named under the performance domains we looked at a little earlier. Principles of motivation and motivational interviewing suggest that motivation is a state, it's not a trait. Conversation style influences readiness for change. Ambivalence is normal. So we also need to leave the decision for change with the client and be supportive and find ways to challenge in a gentle way, but also respect their view. And motivational interviewing is a way to encourage the client to have a voice in what their recovery is about. Motivational interviewing and stages of change model work really well together. And the frames, which you may often hear about related to motivational interviewing, involve giving feedback in a non-judgmental way and based on observed behavior. Responsibility. The client is responsibility for change. The peer is responsibility for change. Advice. Dialogue about alternative actions. Menu. A list of change-enhancing options. Empathy. Expression of understanding around difficulties associated with change. And self-efficacy. Enhance the peer's ability to succeed. And we talked about trauma-informed approach from early on. It was one of the 10 guiding principles of recovery. And when we think about a trauma-informed approach, we're thinking about things like safety, trustworthiness, and transparency, the importance of peer support, collaboration and mutuality, empowerment, voice, and choice, consideration of cultural, historical, and gender issues. So again, I would just reinforce that when we're coming from a trauma-informed approach in a peer setting, we are utilizing universal precautions. We're sensitive that individuals around us may have traumatic experiences and not disclosing that. And so that goes from peer-to-peer work, but also in our professional setting and interaction with our colleagues. I want to thank you very much for your time this morning. I hope that this webinar was helpful, and my contact information should be available here. There's the resources that were mentioned. Again, I can't emphasize enough that the internationalcredentialing.org or ICNRC website is a great place to get resources around preparing for the CRSW exam. And thank you for your time.